Ladies and gentlemen of the press, good morning. Good morning also to St. Lucians here on island and those who are overseas. Good morning to those who have joined us through the internet, and greetings and bienvenue to all. Bienvenue to our press conference with a focus on the government's callous and parmele attitude to the all-important health care of St. Lucians and visitors alike. Since the UWP took office in 2016 and the appointment of Senator Honorable Mary Isaac as Minister for Health and Wellness, we have witnessed a rapid decline in the government's attention to the serious issues of health in St. Lucia, and the situation is getting worse by the day. Our primary healthcare services, which are made up of our health centers and their services, are lacking government support and in some cases outright neglect. The strength of any healthcare system in a country depends on the organization and strength of the primary healthcare system, the infrastructure, and of course the services. What has happened to the refurbishment of the burnt Larishus Health Center? The situation at the Richford Health Center has become critical as a result. Why has the government not started work on the Ancillary Health Center? Allocations and negotiations were done by the St. Lucia Labour Party government, yet this health center has not started. The refurbishment of this health center has not started. The conditions of beds and equipment at the hospitals have not improved. The United Workers' Party in opposition had their candidates visit the St. Jude Hospital to expose the beds, the bed sheets, and other problems. Yet there is still an urgent need to supply our hospitals with those basic supplies. Why has the Owen King EU Hospital not been opened? The Minister for Health has been absent, confused, or she seemed confused most of the time, or missing, and some people say missing at work in relation to the major health issues in St. Lucia. The people of St. Lucia need to know what is happening with the Owen King EU Hospital. What has happened to the Owen King EU Hospital commissioning team? The people of St. Lucia have not received updates on the progress of this new hospital, and the government has placed the development, the opening, the commissioning of this new hospital on the back burner. It has been reported that 12 dialysis machines will be operational at the Owen King EU Hospital before the hospital is commissioned. Is this the same Prime Minister who, when campaigning for office, promised to lead a march on the hospital to get the dialysis machines working? Why has he not explained why those dialysis machines are not yet in operation and helping St. Lucians in 2018, 18 months after taking office? This is the same party now in government which claimed that people were dying because of non-commissioning of dialysis machines at the Owen King EU Hospital. 18 months after winning an election, since 2016, the government is now planning to provide dialysis services without the other medical services present at the hospital. Was the government advised by professional medical personnel to operate dialysis machines without the other medical services of the hospital? Who made that decision? And what are the possible consequences if dialysis patients at the Owen King EU Hospital were to develop complications? Would you then rush them by ambulance to Victoria Hospital? Is that consistent with best practice, with best medical practice, or is it driven by political expediency? There is valuable and life-saving equipment for the Owen King EU Hospital. That equipment was ordered for the treatment of St. Lucians. However, St. Lucians continue to travel to Martinique, Barbados, and other countries while the government pays scant regard to the completion and commissioning of the Owen King EU Hospital. The Prime Minister has stated publicly his intentions to privatize the Owen King EU Hospital. Is it true that the government is about to hand over the Owen King EU Hospital to a private operator? What will happen to the thousands of St. Lucians who access the services of the Victoria Hospital? What will happen to the staff complement of the Victoria Hospital? There are weekly reports of major inconveniences that continue at both the Victoria Hospital and the St. Jude Hospital. Shortages of vital medication, shortage of basic supplies, basic equipment, faulty generators, electrical problems, or lack of response by central government. The people of St. Lucia who access the hospitals, I am sure, can attest and can testify to the stories, can testify with their own stories, some of which are actual horror stories. While our medical professionals and staff of the two major hospitals do their very best and do not report their frustrations publicly, they face enormous challenges that have intensified with this government's neglect. St. Jude Hospital at the stadium is a disaster waiting if the Prime Minister and his cabinet of ministers do not urgently complete work on the St. Jude Hospital to return the patients and medical professionals to a much more secure and adequate facility. All of the evidence suggests that the UWP government is allowing patients and the medical professionals and staff of St. Jude Hospital to suffer for purely private profiteering and political reasons. Is the government in discussions with private businesses to allegedly sell the incomplete St. Jude Hospital? Why is the government not giving the people of St. Lucia an update on the future of the St. Jude Hospital? The Prime Minister promised to make a definite statement on the fate of St. Jude by December of 2017. To date, we have not heard any statement on the fate of the St. Jude Hospital. The Soufrière Hospital suffered from two fires. The Minister for Health has not clarified the position of the government on the Soufrière Hospital. Is it true that the hospital property will be sold? If so, what are the plans for another location for the Soufrière Hospital? Fellow St. Lucians, ladies and gentlemen, what we have in St. Lucia today is a health system on crutches, a system of hospitals and health centers that are not receiving the focus and priority of the UWP government. Every single St. Lucian must stop and focus on the eventual possibility that all of us, me included, will at some point need to access our health services. We would need to access the hospital. Si un mal bout de pont, ou bien si vous voulez accoucher, c'est l'hôpital là où vous allez. Est-ce que vous sentez confortable là où vous allez et le gouvernement pas qu'à bailler sur l'hôpital là? Attention, yo besoin. We need to feel that our government is paying attention. Much progress had been made between 2011 and 2016 to revamp the primary healthcare system with the refurbishing of many health centers. The St. Jude Hospital project was continuing, and much progress had been made. A commissioning team was in place for the Owen King EU Hospital, and preparations were being made to put universal health care back on track, which our government started during the 1997 to 2006 term in office. We cannot be comfortable with the unavailability of medication and the acute shortage of pharmacists on this island. We cannot be happy with the lack of progress on our hospitals. We cannot be still while the UWP government reduces support to our children who are challenged and who receive specialist care. Will you accept that the government continues to disregard the pleas from St. Lucians, both here and abroad, to recommence work on the St. Jude Hospital project with no explanation of what the future of St. Jude will be? Diabetes continues to be an unfortunate plague that haunts St. Lucians. The St. Lucia Labour Party was in the process of finalizing plans for the construction and commissioning of a diabetes research center. In its true vindictive fashion, the United Workers' Party has shelved plans for a diabetic research center with no explanation and no alternatives. Again, amidst all of these crises, the Minister for Health and Wellness seems absent, unaware, or confused. There is no discernible or focused political leadership in St. Lucia's health system. The government simply does not show that it cares about our health system and our most vulnerable people. The St. Lucia Labour Party continues to demand that the government of the United Workers' Party, 1, place St. Lucia's healthcare concerns at the top of its priorities and have the Minister for Health to respond to the many healthcare concerns of St. Lucians. 2, urgently recommence work on the St. Jude Hospital and remove the patients and professionals from what is a disaster waiting at the George Odlum Stadium. 3, give urgent attention to the critical needs of Victoria Hospital, St. Jude Hospital, and the Soufrière Hospital with a view to addressing immediate daily needs. 4, require that the Minister for Health give more focused attention to the critical health sector. All St. Lucians will at some point, I repeat, need to face the healthcare system in St. Lucia. We urge the Cabinet of Ministers to act urgently and stop the suffering of the people of St. Lucia and our visitors, in particular those who cannot afford to access private care or care overseas. Expressement pour ces gens qui passent à payer hélicoptère avec plane pour mener au Miami, avec pour mener au Martinique, pour aller à l'hôpital avec pour faire l'opération. Nous avons supplément des gouvernements pour faire affaires santé pays cette ici, un bagage qui plus important avec faire ministre santé, répondre question à la santé, avec faire affaires santé cette ici, plus important. Merci Anchai. I thank you very much.